Hello and Assalamualaikum. My name is Najwati Binti Muhammad Nassir and my matrix number is BM23110038. Today I'm going to introduce you to oral pathology. What is oral pathology? Oral pathology is a specialist field of pathology dealing with the disease of oral cavity and associated structure. Oral pathology is the study, diagnosis, and treatment of disease in the teeth, gums, bones, joint, glands, skin, and muscle around your mouth. It is science that investigates the causes, process, and the effect of this disease and their subsequent treatments. Next, I'm going to talk about anatomy of oral cavity. The oral cavity, commonly known as mouth, consists of the teeth, tongue, salivary glands, cheeks, lips, palate, and the floor of the mouth. The oral cavity plays a crucial role in various physiological processes, including digestion, communication, and defense against pathogens. This is the anatomy of tongue and teeth. The tongue is a muscular organ involved in taste, speech, and manipulation of food, and the teeth play a crucial role in mastication and mechanical digestion. Next, I'm going to talk about biochemical of saliva. What is saliva? It is a watery secretion in the mouth produced by the salivary glands that aids in the digestion of food. It serves as an aid to swallowing and digestion by moistening and softening food. The formation of saliva takes place in two stages. First stage, the secretory acini produce an isotonic primary saliva with ionic composition is similar to that of plasma. Second stage, the primary saliva is modified as it passes through the duct system by selective reabsorption of sodium and chlorine, but not water, and some secretion of potassium and bicarbonate. The final saliva is secreted into the mouth. Thus, it becomes hypotonic with salt concentration below that of primary saliva. The function of saliva are lubricant and protection. Second, buffering action and clearance. Third, maintenance of tooth integrity. Fourth, antibacterial activity. And the last one is taste and digestion. Here are some of the common oral diseases that can be found. First one is herpes simple virus type 1 or HSV1. HSV1 is highly contagious and is primarily transmitted through the direct contact with infected individuals or their secretion. It is commonly associated with oral herpes, causing cold sores or fever blister on or around the mouth. The symptoms are tingling or itching sensation around the mouth or face 1 to 3 days before blister appear. Cluster of small fluid-filled blisters that develop around the mouth, lips, or nose, and pain, burning, or itching around the blister. Second one is oral cancer. Oral cancer refers to cancer that develop in the oral cavity. Oral cancer can develop due to a combination of genetic, environmental, and lifestyle factors. For example, smoking, alcohol consumption, or poor oral hygiene. The symptoms are lumps or sores in mouth that don't heal, white patches or red patches on the mouth or throat, bleeding in the mouth, and difficulty swallowing or speaking. Third one is candidiasis. Candidiasis, commonly known as a yeast infection, is an infection caused by the Candida species of fungi, primarily Candida albicans. Candida is a type of yeast that normally reside in the human body, including the mouth, throat, intestine, genital, and urinary tracts. The symptoms are white patches, often on the tongue and inner cheeks, but sometimes also on the throat, palate, and tonsil, difficulty swallowing, and loss of taste. And the fourth disease is black hair tongue. Black hair tongue, also known as lingua villosa or lingua nigra, is a condition characterized by the appearance of black or brown discoloration on the tongue. Despite its names, black hairy tongue is neither hairy nor a cause for serious concern. The symptoms are black or brown discoloration of the tongue, sometimes with hairy or furry appearance, bad breath in some cases, and mild discomfort or tickling sensation on the tongue. Next, I'm going to talk about famous oral pathology. One of the famous oral pathology is Dr. Robert Junior Gorlin. He was a prominent American dentist and geneticist known for his significant contribution to the fields of oral pathology and medical genetics. Some of his contributions are he identified over 100 syndromes affecting the head and neck region, with some named after him, such as Gorlin-Gold syndrome and Gorlin-Chaus syndrome. Other than that, he published over 600 articles and contributed extensively to textbooks, shaping the landscape of oral pathology education. Dr. Golin received numerous honors and awards for his contribution to dentistry and medical genetics. His work significantly impacted the fields of oral medicine and genetics. That's all from me. Thank you for listening. Goodbye.